this first podcast from Combined Healthcare. This is the first in a series of episodes through our new Combinations podcast, which we're introducing to give an opportunity to have a more in-depth chat about some of the things that we do and the people that we work with. We've chosen for the first topic something that is dear to our heart and one of our key services, and that is CAMHS. And I'd just like to introduce everybody around the table to introduce yourselves and what you do.
I'm Julia Ford and I'm the CAMHS in Schools lead.
I'm Anne Cox. I'm the nurse consultant for CAMHS and the clinical lead for CAMHS for Stoke-on-Trent and North Staffordshire.
I'm Sam Waterham. I'm the Associate Director of North Staffordshire with a responsibility for CAMHS.
I'm Laurie Thorburn. I'm the lead teacher for secondary school children in a local specialist school.
I'm Ruth Fishwick. I'm a clinical psychologist working in paediatric psychology.
And I'm Dave Hewitt. I'm the Chief Information Officer at the Trust.
Right, thanks very much. Okay, so now, really obvious question to ask starting off. CAMHS. What exactly is CAMHS? What does it do? Who does it help? How does it work?
Well, I guess CAMHS stands for Child and Adolescent Mental Health Services. So we are mostly based at what we would currently call Tier 3 specialist CAMHS, which means that we work with children and young people and families that have significant and enduring mental health difficulties. Although that's our umbrella kind of business, we also have a number of other teams that support working with children and young people. So we have our paediatric psychology colleagues, we have a ASD team, so autistic spectrum disorder team. We've also got a looked after child team.
We also have eating disorders as well in there.
We have a specialist eating disorder, so community CAMHS services, and then we also have the hub, which is our point of access service. We also work very closely with some of our Tier 2 services, so like Changes and Younger Minds.
What is the range of ages that for children and young people that you can deal with?
Well, certainly in paediatrics, because we're a specialist service and we only work with children with a physical health service, we support families where children are newborns. So we go right up to 18. So we skew it slightly in comparison to the core CAMHS services, because we recognise that those families need to have support around dealing with diagnosis at the point of getting that diagnosis, and then support moving on, which will become support for the child as they go through those developmental milestones and different transition points as well. But for core CAMHS, Julia, what's the lowest age that we'd think about with core CAMHS?
We are technically 0 to 18, however, it probably is around 6 years of age, and the majority of the probably younger ends. Also, not to forget our other services, so we've also got our specialist inpatient unit at the Darwin, which looks for kind of teenagers really, so I think that's commissioned from 13 to 18, and also our CAMHS LD service as well. So learning disability service that and I think they work with younger children as well.
Okay, so we're looking literally at all ages from almost newborn to adulthood. What would be some examples of the common sort of services, if you like, that you provide and support?
I think it would probably be helpful to not think about it in medical terms really, and just think about that actually we help young people that have difficulty potentially with their behaviours or their emotions or their thoughts potentially, if they're struggling about keeping themselves safe because of difficulties that are going on, if they've got difficulties at home or in the school or with their physical health.
So it could be an adjustment reaction. So we've talked earlier this morning about the impact of bullying, but also the impact of managing a physical health condition when you get that new diagnosis. So that can bring a lot of other symptoms that we all experience that can be exaggerated for those young people.
And I think similarly in the learning disability children's team, it's helping families to adjust to that lifelong condition, understanding what that's about, understanding the level of ability, and also supporting families depending on what age they were referred into of their developmental age against their chronological age and some of the challenges that come with that.
And I think we do have a very kind of a philosophy around engaging with the family and people that are supportive of that young person. We try to work from a strengths-based model to look at how young people can use skills that they've already got but transfer them into other areas, and really trying to empower that young person really to manage their own difficulties.
Okay, now what's the benefits there, and what do you think works best in terms of CAMHS and the education sector locally working together?
So CAMHS have always been involved outside of school with the pupils that have needed it. But I know the other special schools in the city have all got access to CAMHS within school, within part of the school day. So within my own school, last year we trialled just having a disability nurse in the mornings. We've extended that into this year for a longer period. So she comes into school, helps with talking to pupils that have been referred to her, and also dealing with teachers. We also get to buy into the Stop, Think, Do system, which is now being
it's been rolled out, isn't it?
Across our more sort of able pupils. So there's also training that we collaborate on as well.
Okay, and how do you find the interface between, there's two sort of professional sectors, if you like, the sort of education sector and the health sector? Do you find they work well together, or are there challenges in terms of understanding each other's perspectives or professions?
Having someone based in school has been really useful to have a face, whereas before we were kind of getting information, asked to give information maybe through emails and letters as and when it was required, whereas having somebody that we can speak to face in school and having Julia as a contact means that we've always got somebody that we know we can go to and approach, which has worked really well.
Which brings us on, Julia, to the CAMHS in Schools model. Now, there's a number of innovations that we're doing locally, education and health working together in North Staffordshire and Stoke-on-Trent. But one of the things that I think has been running for a while now is a particularly innovative CAMHS in Schools model. I wonder if you'd like to explain a little bit about what that is and how it works and the benefit and where it came from and all that.
Okay, so the CAMHS in Schools model's been about in the special schools for about 14 years now, and actually started in this school when it was on another site. And they commission the service in, so it's additionality to the existing services that they can get. We educate the staff. We're changing culture, it's understanding mental health and well-being, it's being able to skill the staff up in managing certain situations and difficulties, understanding their levels of need, and also working very collaboratively with parents and carers. So that's been really interesting in a way, developing health and education alongside each other, kind of bringing those relationships together has been really paramount into where we are today.
What would you say would be the thing you're proudest of?
We've got mindfulness in schools it's been delivered across all the schools. So we were able to get 30 staff last year trained in the MBSR, which is mindfulness-based stress reduction, and that enables then to embed mental health and wellbeing across the schools and a mindfulness philosophy within the schools. So there's a current course going on at the moment. This school in particular have developed a mindfulness strategy for their school. Portland, one of the schools that were here this morning, they do mindfulness throughout the day, throughout the start of the day and the finish of the day. So yeah, it's really good. The Stop, Think, Do we've got going on both at Kemble, Abbey, huge amounts of children and young people where we're training the staff to deliver the programme, the mental health and wellbeing programme. So they're looking at giving children and young people the skills to be able to recognise their emotions, be able to label those emotions and think through their choices, and also the very live examples, so even if they make the wrong choice they're able to reflect on that. So we've done all kinds of stuff, restoration, reparation, being able to reflect on some difficult choices that they might have made the day before. So yeah, very much of that kind of culture we're developing. So
what that does then, Jo, is actually enables us to work in a much more collaborative, robust way as a preventer. So it is more of a preventative model, which supports some of our young people not getting embedded into long-term mental health support mechanisms.
I think there's also something as well, because I had the privilege to work as part of the CAMHS in Schools service 9 years ago with Julia, and it's about developing that psychological mindedness of the staff that support the young people in school, so that they can have that consultation with the staff from Combined Healthcare and start to learn different things and different signs and symptoms that they might need to pick up on a little bit quicker maybe, and then know what to do with it, and they can then start to generalise that out to the wider audience and make changes in very small ways that have really big effects.
And I think by training the trainer as well, what you've done is enabled that school now to be able to go on and continue to embed mindfulness without the use of CAMHS in schools, because we've trained the trainers. So it's helping empower the schools and providing a sustainable model.
But I think you mentioned talking about working with specific children, but as an approach we sort of think about, well, we're talking about all the pupils we teach rather than targeting anyone specific, because especially in these day and age that a lot of them, if not all, have some kind of mental health turmoil at least that are going on in their lives, that we need to see it across the board rather than thinking about specific pupils that need interventions. It's kind of just taught as part of everybody's curriculum, and having the training and things like that from staff, getting to know people that they can go to for help is really helpful.
And I think there's something about health promotion has always been about promoting good physical health, but we don't really talk about promoting good mental health, and I think that's the big shift that is happening by things like CAMHS in schools and the approach that we're taking in CAMHS as well. It's about that resilience and looking after yourself and realising what resources you've already got.
Because everybody needs that, everyone needs that bank that they can access, whether they're going on to have more serious problems or issues in the future. All of us need to have mental health, good mental health, or recognise our mental health and know how to deal with that.
And I like to talk about it with young people in a narrative sense. So we're all carrying a rucksack, and we're all putting rocks, boulders, pebbles, stones in that rucksack, and eventually your straps are going to start to break if you don't bolster up those straps. So how can you bolster up those straps? How can you take some of those stones and pebbles out? So it's about looking after yourself and increasing that resilience.
And I think to add to that, we launched a mental health and wellbeing strategy across the school, so they were really instrumental in developing mental health and wellbeing in schools policy, which covers the whole school community, and also looking at staff wellbeing as well. So that's been really exciting, and again I think that launches us into probably where we've come with the bigger thing.
Obviously we're sitting here in the NHS in the immediate aftermath of the publication of the NHS long-term plan, and one of the big themes in that, as we all know, was about a much greater emphasis on mental health and mental health services, and one of the strands of that, particularly identifying national CAMHS Trailblazers. We've been delighted to be selected as one of the national CAMHS Trailblazers as well. Would you like to tell us a little bit about what that's about and what we hope to deliver?
So the National CAMHS Trailblazer is twofold really. The first being that we are to develop 4 new mental health support teams over Stoke-on-Trent and North Staffordshire, and these will include a number of trainees in each of the team that will be education mental health practitioners, and they will also be supported by more senior clinicians. Each mental health support team will look after approximately 20 schools, and the idea will be that these mental health support teams have a core offer that they will deliver throughout those schools to help support earlier access and more timely intervention to children and young people, in the hope that if you access them earlier then you'll have less need for longer term treatment. But this will not just be targeted at the children and young people, it will also be targeted at the parents and also the education professionals that are working within the schools. And I should just point out that although it might not be a mainstream school, it could be a special school, but we're also looking at the pupil referral units and other educational establishments that might not be in your mainstream sector of education. So that's the first element of it. The second element is that we've been tasked to fulfil a 4-week referral to treatment target throughout Stoke-on-Trent and North Staffordshire. So we've had some funds made available to us to try and implement that across the whole geography of Stoke-on-Trent and North Staffordshire. And we're going to do that through a number of routes, really, of having more accessible evidence-based therapists available, but also we're going to redesign the way that we work in terms of our point of access to ensure that that is going to happen. And this will be alongside our other innovation, which will be our digital exemplar. Which, of course, brings us on to Dave, who's been sitting quietly there in the corner. Dave is the Chief Information Officer. So we're here in the school, and we've been having young people here helping us with a particular, another national exemplar programme we're working on, the Digital Exemplar. Would like to explain a little bit about what that's about and what we're hoping to do?
The Digital Exemplar was a national programme that NHS Digital launched about 12 months ago, where the Trust was able to bid to take forward an innovative digital solution which would help us develop our service user engagement. We did quite a bit of work looking across the Trust, and one of the key areas that we identified where we could get the greatest benefit was working with the CAMHS service. The approach we've taken is to look at really the entire pathway through, so providing information very early on to support children, young people, parents, professionals, teachers to move forward, signposting them to other services that are available, so that could be working with some of our third sector partners, different community groups where we could do that, and then dealing with that process where we would maybe have to refer people into our internal services. And then a key element of that is how do we deliver treatment to that young person as soon as possible. So looking around the concept of social prescribing, the prescribing of applications and tools to support very early on in that process, and to provide more information into the treatment phase to support clinicians to have a much greater engagement with the young person, and then to support that person when they leave services, to give them tools to self-manage any condition they've got to support their resilience.
If there's an idea that actually this portal will give you access, and if you're not sure of the answer, we can help you find an answer, to support them, to help themselves, help each other, help parents help themselves, professionals to help that young person as well. I think it's a really exciting venture. And
right, so it seems we're sitting here, in North Staffordshire and Stoke-on-Trent. We've got more money coming in. We've got extra staff coming in. We've got a model working with schools. We've got new developments in digital. I mean, it feels like there's quite a lot going on in this patch of the world.
For me, on a much wider scale and encompassing all of it, Trailblazer, CAMHS transformation, Digital Exemplar, working closely with the communities. It's about developing a resilient culture. It's about looking at how we can start being recovery focused right from the start, looking at self-management and owning, some of the difficulties that we've got, rather than at the moment it feels like a very much a fix-it model. And then nobody kind of owns that. It's everybody's business. And I think one of the bigger key messages that's coming out at the moment, is that mental health and well-being is everybody's business, and that's really quite exciting.
And I think it is around that validation and normalisation that we all have mental health as much as we all have physical health. We all have bad days, we all have good days, and actually that's part of living, but we need to have mental health on the table alongside physical health, and actually we all need to work with it together. And I think for our CAMHS service we have such an opportunity, because not only have we got Trailblazer and Digital Exemplar that sets us apart in our nationally to other CAMHS services, so it really is a huge opportunity and a very exciting time.
Cool, thanks very much. So I guess the message is lots to do, lots going on, really exciting place to be in the NHS at the moment. And obviously if anybody wants to find out any more about any of our CAMHS services and what we do, they can visit the website www.combined.nhs.uk, and there will also, when the Digital Exemplar is up and running, there'll be links to it from there. Okay, so thanks ever so much for taking part in this podcast. Really appreciate it.
Thank you.